Thank you for this opportunity, everybody. Let me get transitioned over here. All right, can you see a blue slide with lots of Band-Aids? All right, so I'll go ahead and launch. As Katie mentioned, my name is Rachel Sizemore, and I serve as the state's public health dentist at the Arkansas Department of Health. Today, we're covering a high-impact preventive service that fits directly into medical practice, although not at first glance. Caries risk assessment and fluoride varnish application. And so by the end of this webinar, my hope is that you will feel empowered to implement this and that you'll understand why it's a high value intervention in pediatrics and family medicine. So our objectives for today's webinar are to prepare you to describe the oral disease burden in Arkansas, to perform an evidence-based caries risk assessment, and to demonstrate correct fluoride varnish application techniques. Beginning with that first objective, let's start at the beginning of the lifespan. So we'll look at pediatric oral health indicators in Arkansas. In 2023, my office, the Arkansas Department of Health Office of Oral Health, conducted a surveillance project analyzing oral health indicators in Arkansas third graders. And results showed that well over half of Arkansas children have experienced tooth decay by the time they reach the third grade, and nearly 1 in 5 of those have active untreated decay. If left untreated, as you know and likely have seen in your practice, that decay is likely to cause pain and possibly infection, leading to additional complications. As we think about oral disease burden and move to the other end of the lifespan, older adulthood, we can extrapolate that much of that decay that began in childhood results, unfortunately, in tooth loss here in Arkansas. The most current data show that over 1 in 5 of our older adults here in Arkansas have lost all of their teeth. And I have this graphic here because that's enough people to fill a Razorback Stadium 1.5 times. I like to show that just because of it kind of helps us get our minds around that magnitude. But why show this dramatic information right up front? Number one is to emphasize the need to intervene before we get to Razorback Stadium, so to speak. And that's my call to you guys. Again, as the state's public health dentist, I'm asking for your help. In light of this burden and this magnitude, decreasing prevalence of oral disease will require a multidisciplinary approach. So why does this matter in medicine? Well, dental caries is the most common chronic disease of childhood, more prevalent than asthma, but unlike asthma, most cavities are preventable. Another reason why this matters in medicine is because children see you all on the physician side far more frequently than they see us on the dental side between the ages of 6 months and 3 years. And so physicians can serve as that front line for prevention and really increase uptake of these types of preventive interventions. Fluoride varnish is considered safe, effective, and reimbursable, making it one of the easiest wins in practice, and then it is legal and encouraged here in Arkansas. If you'll permit me a very short history lesson, I'd like to take us on a little back in time, about 10 years. So in 2015, a law was passed authorizing physicians and nurses to apply fluoride varnish without breaching their scope of practice or encroaching upon the scope of a dentist or hygienist. And we'll get into the nuts and bolts of that statute as we go forward. But by 2019, so just a few short years later, according to data from the All Payer Claims database, we had quite a few providers performing and billing for at least 20 fluoride varnish applications that year in 2019. In my opinion, this has been one of the greatest dental public health wins in Arkansas because it expands that preventive footprint significantly. And another thing we learned from this timeline and from this data is that we do have room to grow. There's more than 54 pediatricians in Arkansas, more than likely. So we have room to encourage more folks to apply this intervention for oral health for kids in Arkansas. So my second objective today is to help you perform a caries risk assessment. Please excuse me, I'm seeing my own physician in just a few short hours for whatever's going on here, so I can't find my mute button quickly. Excuse me. So let's start with some definitions about caries risk assessment. The purpose of a caries risk assessment is pretty evident in the name. You're assessing a person's risk for developing this disease. But you can think of it as a balance between risk factors and protective factors. So a caries risk assessment is required by that statute that I showed in our last slide before fluoride varnish is applied. And it helps determine how frequently to apply fluoride varnish. So those that are at highest risk should receive every 3 months. Those that are at lower risk could receive every 6 months. And it really sets kind of an agenda of topics to discuss with caregivers as well, as you have the time and ability to do so. So, as you likely know, dental caries is a disease caused by bacteria, behavior, and enamel susceptibility. So, it's kind of a combination of factors that lead to dental caries or cavities as a disease. And the goal of this caries risk assessment is not just to find cavities, but to identify those factors that are putting this person at a higher risk before the disease occurs so that behavior modification may be able to prevent as well. So the good news is that in a medical setting, this can normally be done in under a minute with a simplified evidence-based approach. For this slide, the box on the left highlights the major red flags that we consider for caries risk. Things like visible plaque or white spot lesions are early signs of demineralization. Frequent sugar intake, especially between meals, special healthcare needs, low socioeconomic status, and drinking sugar-sweetened beverages in bottles or sippy cups can particularly put a person at high risk for developing cavities. But one of the strongest predictors of pediatric cavities is actually whether or not mom has had cavities in her lifetime. So why would that be? Well, as you may know, because cavities are caused by bacteria, they are in fact contagious. But that's a conversation for another time. That's a whole maternal health conversation. So like I mentioned, a caries risk assessment is about balancing factors. So on the protective factors side, things like the use of fluoridated toothpaste or drinking fluoridated water, having an established dental home, meaning getting regular dental care, significantly reduces risk, of course. And then good brushing habits decrease the bacterial load as well, making it less likely to develop those cavities. The AAP has developed a wonderful tool that not only identifies risk factors, but also offers some solutions like action plans and self-management goals for parents and patients to consider. This QR code on this slide links directly to that tool, and although I've only screenshotted the first page of it that goes through some of the risk factors and self-management tools, it also includes helpful pictures that can delineate between some of the things I mentioned before, white spot lesions versus cavitated lesions. I know some of that is kind of out of the wheelhouse on the medical side, and so it's nice to have a picture that really kind of highlights, here's what's normal and here's what's not. So that's all from the AAP, a wonderful tool. Moving into our third objective, to offer tips for fluoride varnish application and help you be able to confidently demonstrate that skill. Fluoride varnish is something that we're even talking about in the first place because it's been shown to reduce the incidence of caries by 18 to 45%, depending on how frequently it is applied. And the AAP recommends varnish starting at the eruption of the first tooth and then following every 3 to 6 months thereafter, depending on that caries risk level. It is considered safe all the way down to infancy for people of all ages. Generally, it tastes fairly mild and comes in a variety of flavors, and it takes less than a minute to apply. Nearly all Medicaid programs, including our program here in Arkansas, as well as many commercial plans will reimburse medical providers for applying this. So clinically and operationally, it is a high value service. Let's talk about techniques a little bit. So starting with preparing the patient to receive a fluoride varnish application, you want to get in a comfortable position where you can actually access the mouth. And I think a little bit later in our presentation, we'll discuss the knee-to-knee method, which is convenient for some, or face-to-face works well too, depending on your child's age and compliance level. In preparing for that application, it's helpful to dry the teeth with just a 2x2 of gauze because the varnish does set on contact with saliva. So it can be nice to dry off a little bit as much as you can before applying so it doesn't get too set as you're trying to apply on multiple teeth. One thing that I do, this is just kind of an aside of how I apply or how I prepare the patient. I try to have the patient just stand in front of me and ask them to smile like they're saying cheese. And so in that position where they're saying cheese, I start with the anterior teeth, those in the front, because they're naturally more dry because the lips are not necessarily in the way. And then I'll do the back teeth toward the end once the varnish has started to set. So that's just a little free tidbit about how I apply. Be sure that you're using the appropriate dose, just a small amount, just a small varnish, as the name implies, on the teeth. It's not necessary to use the entire well of fluoride as you are applying. So we'll see some pictures later in the presentation, I believe, of actual the fluoride product. Again, you do not have to use the entire well full of fluoride. It's just a thin varnish to cover the teeth that are present. When it comes to applying, of course, you're going to want to expose the teeth either by lifting the lip or having the child smile or open their mouth. Paint the varnish quickly, emphasizing smooth surfaces of the teeth versus posterior grooves. It's helpful to get fluoride in all of those locations. However, fluoride varnish is most evidence-based for preventing smooth surface cavities. In other words, the fronts or the backs of the teeth, not necessarily those groovy portions of the molars. When applying, it's important to reassure the patient the taste is mild, but they will notice that the consistency gets a little sticky, and a lot of times children will have kind of a reaction to that, kind of running their tongue over their teeth and making funny faces. Just reassuring them that that is normal because, again, it does set on contact with saliva and become a little bit sticky. For aftercare instructions, no brushing or flossing for the rest of the day is generally a good rule of thumb. And then avoiding hot or crunchy foods that could melt or break the fluoride varnish off of the teeth. Resuming normal brushing the next morning is recommended, and then plan to receive again in 3 to 6 months. Of course, these aftercare instructions are general, and I would advise always using the manufacturer's instructions for whichever product you choose to use. And then last but not least, being sure to document your caries risk category that you assessed for that patient, any parental or caregiver counseling that was provided based on what was identified in the risk assessment, documenting that the varnish was applied, and any dental referral that you might have given. So when it comes to integrating this intervention into your practice, you may choose to apply directly as a physician, or it may work better for your practice to delegate this task to another licensed provider. I've copied here the wording from the statute that does allow under physician supervision for other licensed professionals who have completed training on caries risk assessment and fluoride varnish application to actually do that application for you. If you should need to provide staff with an approved training in the future and they don't have access to this recording, or you just need another source for providing this training that is quote unquote approved by the health department, this Smiles for Life online training is where we typically will refer folks. It's got a nice body of content, and one training in particular specific to caries risk assessment and fluoride varnish. And so that is considered approved by the department if you should need a future presentation on demand. So key takeaways from my portion here: oral disease affects more than just the mouth, as you know and likely have seen and experienced in your practices, because the mouth is a part of the body. So that's one reason I'm so glad to be here today, just kind of helping to remind that we're bringing the mouth back to the body here with this integrated intervention. Medical doctors do play that critical role in preventing dental disease because of the frequency with which you see children that are at high risk. Caries risk assessment takes less than a minute, and fluoride varnish is one of the highest impact interventions we can offer, safe, reimbursable, and evidence-based. So if you do one new thing after today, I hope it will be making fluoride varnish application and caries risk assessment a routine part of your practice.
Thank you, Dr. Sizemore. Does anyone have any questions for this half of the presentation today? And feel free to come off mute or put your questions in the chat. All right. Dr. Burr, if you are ready, you should be able to share your screen in your presentation. And if anyone thinks of a question, feel free to put it in the chat. And we can either answer it in the chat or we can answer it at the end.
Okay. Can you guys see it? Does it look like a
Perfect.
proud? Okay, cool. Because this is not, there's even a video embedded in here, which I anticipate probably won't work, but we'll see. So anyways, I'm Natalie Burr. I'm the oral health advocate person for the Arkansas chapter of the Academy of Pediatrics. And I am just going to talk a little bit about the practical piece of applying fluoride varnish in the pediatric office. So first of all, just kind of talking about supplies that you would need to purchase. So we have the actual varnish, and you can see up here in this top right picture, this is the particular one that we buy, and I'll talk a little bit more about pricing here in a minute, but they come in a box. I like these because they're little individual. You can kind of see on the side of the box, it's like a little individual brush and well that you can use. And these particular ones also have like little tear off paper pads with like tear off instructions for the families for aftercare. You will, of course, want to wear some gloves. They do not have to be sterile, so just regular gloves. And then the gauze pads, I prefer these non-woven ones because sometimes the regular gauze strings can get kind of like hung up on teeth, but regular gauze works fine too. And then it just has again here the instructions for applying every 3 to 6 months. So for the actual application, for younger kids, so I would say generally for kids under 3, I use this knee to knee position. And basically I just tell the parents, I say, hey, sit them in your lap like you're giving them a hug. Just wrap their legs around your waist. And once I'm ready, I just have them lay the child's head in my lap. I will say that I usually have the parent hold their hands so they aren't like grabbing the brush or getting the sticky fluoride varnish on themselves. I dry the teeth with the gauze and then apply just a thin layer of varnish to the tooth surfaces. In this particular picture, the varnish I use actually isn't the yellow color, but a lot of the varnish you can buy is. In this picture, they're using that yellow color varnish where you can really see which surfaces you've applied it to. And then you give them the aftercare instructions. So usually during this part of it, I'm, kind of talking to the parent as I'm doing it. I'm saying, I'm doing this fluoride varnish. This helps protect the teeth. You should also be brushing twice a day with, a small amount of toothpaste, fluoride toothpaste. I talk about the amount of fluoride toothpaste they should use depending on the age of the child. I talk about how, they should be seeing a dentist. This doesn't take the place of seeing a dentist. And as I'm doing the exam and applying the fluoride varnish, I might show them, hey, these little white areas, this is why we talked about really trying to get them off the bottle, or showing them areas that maybe look like early decay, and explaining where they should be brushing and flossing their children's teeth. So that's kind of that, discussing any relevant exam findings. Okay, this is a video that it looks like it's not wanting to show, so I'm gonna try something different here. Maybe if it'll let me change the screen I'm sharing.
You might be able to stop and then re-open.
Reshare.
Yeah,
Okay.
if it's on YouTube or something.
Yeah. Let me see. Of course it doesn't. Okay, here we go. Stop share. Let me try this. Because of course I have like 50 things open on my screen. Um, Here it is. I think this is it. Okay. So this is just a quick video, um, just kind of showing how it's applied. Well,
I don't think we can. Is there sound?
oh, you're not getting sound.
Mm-mm.
Well, I'll just narrate. Can you hear me?
Yes.
Okay. So this is, just talking about the supplies you need, or gloves, gauze. Wow, it's just not going to work out too well for me. There we go. So it's basically just showing here and freezing. Well, okay. Showing here basically getting the child ready for applying the fluoride varnish. Um, wow. Well, this isn't going as planned. Okay, you can see here she's just going to lay the child back in her lap, and then getting ready to apply the fluoride varnish. So you can see here how the parent has the child's legs on either side and the parent is holding the hands. And it actually is pretty helpful if the child cries during the exam, because then their mouth is open. And it allows you to see the teeth, dry them off a little bit easier. After the teeth get dried off, then you apply the small amount of fluoride varnish, which you can see them doing here in this video that's skipping so helpfully. This here shows it's a little bit more detailed. This video suggests applying it in 4 specific quadrants. I think that unless you have a very cooperative older child, that's kind of difficult to do. But definitely, just trying to visualize all the teeth. A lot of the time, if I have a kid that's really fighting me more, I'll use, if they don't have these back molars, I'll get a finger, in the back of their mouth, kind of to hold it open. I have done a tongue depressor before. But basically, you're just getting this thin layer here and trying to apply it to all the surfaces of the teeth that you can visualize. Um, and then that's really it. I don't know. And then it just talks about the aftercare instructions. So waiting till the next morning to brush teeth. They can have, warm or cool liquids right after. They can have soft foods after. You just want to avoid like sticky candy and that kind of thing. Okay, so we're gonna stop that because that didn't quite go how I wanted it to. And then I'm gonna switch back to my slideshow, if that's okay. So Okay. So, can everybody see this now where it's showing the cost and the reimbursement?
Yep.
Okay, cool. Okay, so for cost, about $1 to $2 per applicator. I think these that I use, I think are a little bit on the nicer end, and they're probably like 175 per applicator for that whole box of gauze that I think had like 50 gauze in it. It was $1 about for that box of gauze. So for reimbursement, Medicaid actually reimburses really well for this. So, every 6 months, it has to be, Medicaid's very specific. It has to be 6 months and 1 day. Okay, so if it's been like 5 months and 28 days, they're not going to reimburse it. But every 6 months, they reimburse 19.95, and they'll actually do that till the patient is 21 years old. And so, I have at times when I've seen families and, the I, of course, am always trying to get them in to see a dentist, but if, it seems like that's probably not going to happen soon, or if I know the child hasn't seen a dentist, even in my older patients, I will go ahead and do this. For private insurance, usually anywhere from $10 to $19. They also are going to be every 6 months. So Blue Cross Blue Shield, you can see, does about $18 until the child's 3 years old, and then they only do it once a year. United and Cigna both do it every 6 months until kids are about 5 or 6 years old. And my goal is always, I usually, because I start talking about this when my patients are about 6 months old, I mean, usually by the time kids are 3, I've got them, especially here in Central Arkansas, where we have so many pediatric dentists, I've got them established with a dental home. But it is nice to, have that option for patients that, for whatever reason, are not established with a dental home to be able to continue to do their fluoride varnish. The code right down here is this 99188. And that is, again, the code you put in for fluoride varnish. We have it integrated into our EMR, where we can add that in. We also, and I think this is on the next page, but integrated into our EMR. Oh, is it not there? Yeah. We have it for specific age groups, like as an option to click in the template, starting at 12 months, although you can do it younger if the kids have teeth starting at 6 months. For some other options to just kind of integrate into workflow, if it's kind of your clinic's policy where you're going to say, okay, we're going to do varnish at 12 months, 18 months, 24 months, 30 months, 36 months, those are all well child visits that we do. Does the nurse kind of know that? And if you've got, the little holders on the outside of the door where the nurse puts the paper chart, do they put a fluoride varnish in there to remind you? We've also, some of the providers that I work with have suggested having the nurse or the MA at the beginning of the visit at those ages. Hey, are you seeing a dentist yet? If not, let's go ahead and do some fluoride varnish. And then, as Dr. Sizemore mentioned, the option for the nurse or MA applying the varnish after they've completed some training, like that Smiles for Life training, they can apply the varnish for you, and you can still bill the same code. And then this was just a little bit more details about Medicaid. So, to be able to bill Medicaid for the varnish, you need to upload a certificate that says that you've had the training to get that, where you can bill for it, and that's on that MMIS portal. Attending this webinar or watching the recording does count as training, and we can figure out how to get you that certificate that can be uploaded. And then just wrote down also the other approved training, which I think Dr. Sizemore already showed.